Okay, thanks very much, and thank you for the European Connected Health Alliance for this opportunity to talk to you for 5 minutes today. It was announced last week that in the UK, 8.5 million visits to accident and emergency last year were unnecessary. Why is this? Primary care in the UK is overloaded. Patients aren't able to ascertain what is appropriate medical intervention for themselves, and waiting times for appointments have now grown to being 2 to 3 weeks. Good4HEALTH currently provide mobile services to healthcare providers in the UK. These services are based around SMS-based reminders for appointments and SMS and cloud app surveys for patient experience and feedback. SMS is very popular. For our surveys, we get an average response rate of 45%. Two-way reminders can help to reduce missed appointments by an average of 25%. Today, what I would like to do is concentrate on a new product that we've launched, which is designed to save money and alleviate pressures on healthcare providers. We call it Synapta Chat. This is a cloud-based web interface that allows an agent or admin or operator to handle multiple chat requests from service users, but not just from web chat. Web chat has the problem that not everyone is in front of a computer at that time or on the web. For the first time, we add SMS, cloud apps, and also popular chat apps like Snapchat. Our aim is to increase the efficiency of the health provider by allowing them to handle more requests. We did try an automated diary rearrangement system using SMS, but it wasn't totally successful. Each patient is an individual with individual and specific needs. Could be that they only want to see designated clinicians of choice for perhaps specific lengths of appointments because of conditions or on certain days of the week, or they may have some individual health issues that dictate the type of appointment. We could create algorithms for each patient, but providers are scared that they'll lose the personal touch of being able to discuss specific needs with patients. Synapta Chat allows a service user an opportunity to contact a provider using SMS or chat to request information, make or rearrange an appointment, gather test results, or ask simple questions. We live in a digital age, and yet a general practice that we work with in England has 16 agents on the phone every morning between 8 and 10 o'clock, just answering the phone to make appointments. And most patients still get an engaged tone or hold music. Busy patients may prefer to use a digital means. Web isn't always convenient and doesn't store an audit trail. However, SMS is particularly useful as everyone has access to it on a mobile, and it will show the flow of information that takes place. Essentially, a request is received by the provider. In this case, if it comes in by SMS, there's a message that's received, and the operator can see any queued requests. We estimate that each operator could handle about 8 simultaneous chat conversations alongside answering the phones at the same time. What they can do is they can pass the request as well to a named individual or someone else that's available, could be a medical clinician. And through this chat system, they can arrange to call the user at a more convenient time when they're maybe not so busy as well. In this particular request, someone has asked about vaccinations for a foreign trip. We can use canned responses to be able to give quick access to links on the web of information. We can help them to book an appointment with a suitable clinician. We can pass the chat on to someone else, and when the call's closed, it will push the information back into the patient record, so there's a complete trail and audit of the information. We can also choose to send a survey to the patient at that time by SMS or cloud app to allow them to measure the quality. All of the information that comes in, we run through a process called thematic analysis. This is where we can automatically categorise the free text information into different code frames so that, for example, we can find out how many calls this week were about medication, how many were rearranged appointments, and then we can evaluate the performance. We estimate that it can save about 15% of the appointment time in a practice per week, which adds up to about half a clinician per week in the average practice. And we think that it will reduce waiting times by around 3 days. Thank you very much.
Thank you very much, Jim.